enforcement officers, our firefighters and ambulance drivers, our grocery workers, truck drivers, our pharmacists. Let's be good to them. The stay-at-home order is an opportunity for the rest of us to do our part to protect the people who are on the front lines of this fight and the people who are most vulnerable to its consequences. I ask you to help them out by simply staying at home. You'll be keeping the virus from spreading, and you'll be helping the heroes who live and work in your neighborhoods. Today, I'm issuing a call to action in the fight against COVID-19. We're in the middle of a battle, and we need reinforcements. I'm asking all former physicians, nurses, physicians' assistants, nurse practitioners, and respiratory care therapists who've recently left the field, whether for retirement or a new profession, to come back and join the fight against COVID-19. We need your help now. We'll be waiving the fees and expediting licensure so you can rejoin the healthcare workforce right away. On Monday, your healthcare license reinstatement form will be available on the Illinois Department of Financial and Professional Regulation website. That's at idfpr.com, idfpr.com, and on our COVID-19 website at coronavirus.illinois.gov. These applications will be processed on an expedited basis, and we'll be coordinating with hospitals and healthcare sites throughout the state to deploy these re-enlisted medical professionals to the front lines. Also, for medical professionals whose licenses may be expiring, we are automatically extending your licenses through the end of September. Finally, for healthcare workers living at our borders who may be practicing in cities outside of Illinois, we're going to make it easier for you to also practice here. This will allow health systems in places like the Quad Cities and East St. Louis to deploy physicians where they are needed most on either side of the border. This is heroes' work, and all of you have our deepest gratitude for your willingness to serve. As I mentioned yesterday, we are working to expand the availability of childcare for all our essential workers through a new expedited emergency childcare center license to provide care in much smaller group sizes than standard centers. Already, we've had more than 150 centers apply for this license. My Department of Human Services is also developing a grant program to support centers and homes serving the children of low-income essential workers. If you're a provider, an interested organization, a parent or guardian, you can learn more about these options on our coronavirus.illinois.gov website in the coming days. On that note, I just want to take a moment to thank our child care workers from the bottom of my heart. In this time of instability, these providers have remained a silent and steady force of helpers who serve such an important function across the state. We could not keep our essential workers going without your service, and I am so deeply grateful for all that you do for their children. Lastly, let us remember that this virus is not tied to any specific ethnic group or race. People from every demographic, every race, ethnicity, gender, or background have been infected. Suggesting otherwise, or engaging in racist speech or acts, is one of the most profoundly un-American things that I can think of. Instead, the current crisis should drive home to all of us just how connected we all are. We can choose how we want to come out on the other side of this. Let's choose to be one Illinois. I'd like to introduce the Director of our Department of Public Health, Dr. Ghazi.
Thank you, Governor. Again, my name is Ghazi Ezike, and I'm proud to be part of this administration serving as the Illinois Department of Public Health Director. I have to share with you the additional cases. We've added 168 new cases, and unfortunately that includes a death. A gentleman in his 70s who resided in Cook County. That brings our total to 753 cases with a total of 6 deaths. And for each of the families represented by these fatalities, we all offer our support and prayers. This virus is here and it's in our communities. All of your governmental leaders at the local and state levels are working 7 days a week to do all that's possible to mitigate this situation, to lessen illness, and mostly to decrease deaths. What's important now is to try to reduce the further spread and prevent our healthcare system from being overwhelmed. As your governmental leaders do our best, we are asking that you as individuals also do your personal best. Some of the ways you can do that are simple but powerful, and that includes washing your hands frequently for 20 seconds with soap, the social distancing, staying home when you're not well. In addition, you can protect those people who are on the front lines, the doctors, nurses, physician assistants, all the healthcare workers who work so hard to care for those who are sick, including knowing that they could encounter and will encounter people infected with coronavirus. Nevertheless, they go to work every day, putting their health at risk, knowing that they are encountering these patients. I want to also add my thanks for these brave, strong, dedicated men and women. During this unprecedented public health emergency, stocks of personal protective equipment, also known as PPE, are being used rapidly. The availability of critical resources such as gloves, gowns, eye protection, and N95 respirator masks is essential. To maximize the state's availability of this PPE, IDPH released guidance to limit non-essential adult elective surgery and other medical and surgical procedures, including dental procedures, until further notice. We are encouraging strongly all ambulatory surgery centers and veterinarians to donate PPE that is not immediately needed to assist healthcare workers, healthcare facilities, and first responders who are on the front line actively responding to COVID-19. I implore people to do what needs to be done to prevent additional people, including our crucial healthcare workers and nursing home staff workers, from becoming sick. Stay home. Yes, that means sacrificing getting together to celebrate what should be some festive milestones. Let's all stay home so that we can all celebrate down the road. All of our actions have significance. Eye protection and N95 respirator masks is essential. To maximize the state's availability of this PPE, IDPH released guidance to limit non-essential adult elective surgery and other medical and surgical procedures, including dental procedures, until further notice. We are encouraging strongly all ambulatory surgery centers and veterinarians to donate PPE that is not immediately needed to assist healthcare workers, healthcare facilities, and first responders who are on the front line actively responding to COVID-19. I implore people to do what needs to be done to prevent additional people, including our crucial healthcare workers and nursing home staff workers, from becoming sick. Stay home. Yes, that means sacrificing getting together to celebrate what should be some festive milestones. Let's all stay home so that we can all celebrate down the road. All of our actions have significant consequences. For those who won't make these sacrifices, that puts all of us at risk. We are seeing how interconnected our entire community from the top of the state down is. We really want to take care of our medical providers who may need to care for your loved ones if they become similarly infected and need heightened care. The science is clear, and common sense is even clearer. If you don't have the virus, you won't get sick. If you're not exposed to someone who has the virus because you stayed at home, then you don't get the virus, and you don't get the virus, you can't spread the virus. It's as simple as that. Let's stay home and try to keep our whole state as healthy as possible. And with that, I will summarize the points for our Spanish-speaking community. Hoy reportamos 168 nuevos casos de COVID-19 aquí en Illinois. Y con gran tristeza anunciamos una muerte. Un residente del condado de Cook en sus 70s a muerte. Ahora tenemos 753 casos que incluyen 6 muertes. Sabemos que COVID-19 está en nuestras comunidades. Lo importante ahora es tratar de reducir la transmisión y asegurar que nuestro sistema médico se mantenga operativo. Para hacer esto, debemos proteger a las personas de primera línea, los médicos, las enfermeras y todos los trabajadores médicos. Ellos trabajan duro para cuidar a la gente infectada con COVID-19. Trabajan todos los días, poniendo en riesgo su salud y tal vez incluso sus vidas. Quiero dar las gracias a estas personas valientes, fuertes y dedicados. Durante esta emergencia de salud pública, se están utilizando rápidamente recursos críticos: guantes, batas, protección para los ojos y máscaras. N95 son críticos para mantener seguros a los trabajadores. Para maximizar estos recursos, el Departamento de Salud Pública limitó la cirugía electiva para adultos. Esto incluye todas operaciones dentales. Nosotros estamos pidiendo a los centros de cirugía electiva y los veterinarios que donen equipo de protección personal. Esto va a ayudar a los trabajadores médicos que están en la línea del frente respondiendo a COVID-19. Una vez más imploro a todos que se queden en casa si están enfermos. Es una cosa simple. Si no contractas el virus, no los puedes dar a otra persona. Tenemos que trabajar juntos para luchar contra este virus. Debemos hacer nuestra parte. Vamos a salir de esto juntos. Muchísimas gracias. And now I will turn it over to Governor Pritzker for questions.
Thank you, Dr. Ezike. And before I take questions, I just want to express some gratitude to not only our director of the Department of the Illinois Emergency Management Agency, that's General Tate Nadeau standing behind me, but also the many people that work with her at the State Emergency Operations Center, which is working 24/7 on behalf of the people of the state. Representatives from the National Guard, from the Army Corps of Engineers, from the Department of Health and Human Services in Washington, D.C., representatives of agencies all across the state of Illinois. They're working very hard for you, monitoring the situation all across the state, making sure that we have up-to-date and good information, and as well responding to emergencies or urgent action that needs to be taken. So I just want to express my gratitude to all of them for the work that they're doing. They're there right now. They may, in fact, be listening to this. And so thank you to all of you who are working today and every day to keep us safe. So with that, I'd take any questions you may have. Yes, sir.
I'm one with the Korean TV, and I wasn't here yesterday. I'm sure you mentioned yesterday. I get a lot of calls from the viewers regarding whether they open their stores or not. So can you highlight again with the essential business thing?
Thank you. So first, I would advise anybody to go onto our website. They can find the FAQ, the frequently asked questions, as well as the order itself, and they can read for themselves who's included and who isn't. Anybody that is operating an essential service, a grocery store, a pharmacy, a gas station, I couldn't list them all. There are many, many, but it goes into financial services, for example, which is vital for making sure that our markets continue on, banks and so on. People can access cash or their bank accounts. So there's a long list on there. I would suggest that people go to that website to see. I would say anybody that might be operating, for example, a clothing store does not fit into that category. Just giving you one example of not considered an essential business operation. We put that list together from a list that the Homeland Security Department in Washington, D.C. has, and then we tried to localize it for the state of Illinois, where we have some different types of industries that we wanted to make sure were covered. Yes, sir.
So what about the restaurant industry with the carry-outs?
Yes.
There are people who do deliveries on bikes, and they do it on foot, they do it in cars. Will they be affected?
There's a specific reference to them in the essential business services of allowing deliveries of food and other packages. Obviously, we want to keep the people who want to order things online, delivery, we want to make sure that happens. And then, of course, shipping is very important because we need to get the supplies, medical supplies, and other things, and we need to stock the shelves of our stores.
We'll take one more from the room, and then we'll go to
Yes,
our
ma'am.
reporters online.
On-air network. A lot of people have been concerned about how this is going to be enforced. What instructions have the National Guard, the state police, and the local police been given in terms of how they are to enforce the stay-at-home request if people are out on the street?
Well, we are certainly asking the residents, the citizens of Illinois, to enforce themselves, right, to make sure that they follow the rules. We hope that people who might see somebody else doing something that's against the order might say something to them. It's not their job to intercede, but if the law enforcement officers out on the streets would see something, they certainly would say something to people. Their next course of action, if somebody were to refuse to comply, would be to get a cease and desist order from a court. So if it was a gathering, somebody's having a picnic, a large group of people who are just disobeying the order around the number of people who should gather, which is limited to 10, they might need to go to a court to get a court order to get that party, that activity to cease and desist. In the extreme circumstance, an officer could charge somebody with reckless conduct, which is a misdemeanor. If they're truly engaging in reckless conduct, most people will simply be making a mistake. They're not standing 6 feet away from each other. They're standing a few feet. Those are the kinds of mistakes nobody's going to hold anybody responsible for. And we're not encouraging police. We're not looking to put people in jail or to fine them for this kind of activity. What we really want is for people simply to obey the rules. This is about keeping everybody in our community safe, including the law enforcement officers, including the neighbors and your friends and your family members. But people are still encouraged to go outside and, if the weather allows, to go on a walk, to take your dog on a walk, to take your child out, and so on. There's nothing wrong with any of that. And going to the grocery store, going to the pharmacy, if you need to check up on a neighbor or a friend, those things are all, allowed, and something that certainly I would encourage, and I would especially encourage checking up on, calling your friends or people that you know who are healthcare workers and on the front lines, who are first responders. Those are people who are so vital to us, and they should know how grateful you are, and I would hope you would ask them if there's anything that they need that you might be able to do for them.
Okay, we're going to go to questions from our teleconference line. Can you share information on how many people with COVID-19 are hospitalized in Illinois? Anything on the recovery rate? Also, how low is Illinois on PPE?
I'll take the PPE question, and then I'll hand it over to Dr. Ezike on the other questions. It's certainly true that everybody all the time would like to have more PPE. We have inventoried PPE across the state. We have a reasonable handle on what we've got and what the hospitals need. But I am every day reaching out to manufacturers and suppliers, distributors to get more PPE. We put in an order just the other day for masks. We and expect delivery relatively soon of a new order of masks for the state. Gowns and face shields and gloves. All 4 of those are items that people in healthcare need. And then, of course, we need masks, particularly for those who are first responders, firefighters, law enforcement, and so on. So we're keeping a reasonable inventory count and making sure that we're not going to run out of those things. But I must admit that we've gotten no help from the federal government, or let me say limited help, because we did receive some PPE. When we put in an order, we got 25% of what we asked for from the federal government. But I believe that we are acquiring at a reasonable rate. But I have an office of people, several of them are dedicated to just this, to getting into the supply chain and getting every item that we need to make sure that our healthcare operations and our first responders are covered. I'm going to hand over to the doctor for the other.
And just to add on to the PPE, again, as we talk about how everybody in the community is interconnected, again, the order to stay home and to avoid large groups, the more people stay home and the less the disease spreads, the less PPE that is needed. So when people are looking for what they can do, this directly helps decrease our need for PPE. And I'm also really grateful for the question that's asking about who's well and who's hospitalized. And I really think that, a lot of the information we're sharing is just the numbers are going up and really sad to announce deaths. But I will include going forward more information about the numbers of people who are just recovering and they're home or just self-isolating for a smaller amount of time. So I will have those numbers going forward, but the vast majority of people do recover uneventfully without being in an ICU, without being in a ventilator, and I do want to highlight those, and so that will be highlighted going forward.
And the challenge that I might say, so it is true that the vast majority of people will recover from having COVID-19. The problem is that the numbers of people overall who are getting COVID-19 are so large that even the small number of people who have trouble recovering is more than our healthcare system may be able to handle, and that's why we're all working so hard to make sure that we keep our social distance and that all of you obey the stay-at-home order that came out yesterday.
How will you determine when to let up on the stay-at-home rule? What science or numbers will be used?
So it's a good question, and I have to say that there is right now, because the testing is so limited, still so limited, we have limited information, and so we're relying upon not actual testing by itself to determine the answer to when could you let up orders like this, but rather on the math and the statistics surrounding what we do know, so that we're looking at what's happened in other countries. Scientists and statisticians are looking at the projection that's happened there upon us. So that will help us determine, as we see hopefully more testing and an arc perhaps of not necessarily a lower number of positives, but a bending of the curve of positives, so that instead of going straight up and you see it going up by hundreds a day or 100+ people a day, and it will go up more per day as we go forward. When we get to a certain point, we'll start to see that, let's say, leveling off a little bit more. So there'll be a smaller increase. That will tell us that it's working, and then as that moves, we'll be able to project further when we might be able to change some of the rules that we've got currently.
This is a question for Dr. Ezike. How confident are you about the asymptomatic transmission?
Yeah, that's a great question. So we know that before you develop symptoms, you have to have the virus in your system. And the virus, the virus replicates rapidly. So you get the virus, and then it replicates in your system, and then you develop symptoms. So we know that from when you get the virus to when you get symptoms, there could be some time in there, maybe a day or two. And so the issue is, how do we think that virus that's in your system now gets transmitted to another person? And so from what our best evidence shows, we think the majority of the transmission has to do with droplets coming out from sneezes or coughs, potentially from contaminated surfaces being touched and then introducing that virus into your mucous membranes, whether it's your mouth, your nose, your eyes. And so that's why the attention to cleaning surfaces frequently and to cover your cough and stay home when you have the cough. So yes, we know that you could potentially have the virus at, say, day 0, but the likelihood of transmitting it that time is significantly lower, which is why we prioritize people with symptoms, because we know the direct method by which people would transfer it to another individual.
Okay, this will be the last question. We are getting tons of questions from people who work in manufacturing asking why they are not shutting down and are considered essential. Can you elaborate on what manufacturing sectors are essential and why?
So again, I would direct everybody online to the frequently asked questions and to the order itself. It actually outlines quite a long list. The intention here is that there's a supply chain of manufacturing that occurs not just for the end product that you see on a shelf, but all the way back. You know, the bread that you see on the shelf is not just the bread itself, but there's a twist tie and there's a plastic bag that holds the bread. Those are all manufacturers that are necessary in order for that good to end up on the shelf. The same thing is true for bottle makers for pharmaceuticals, for example. It's not just the pharmaceuticals, but someone makes the tops, someone makes the bottles. You can see that there's a whole supply chain behind many of the things that are necessary for everybody's daily life. And so we want to be, to make sure that essential business operations includes all of the supply chain across the board. So again, for people who are curious about whether companies in their industry or something they're interested in is covered as an essential business operation, they should go and look at the order that we issued, the executive order, and also at the frequently asked questions. I'm going to take one more question from the last person in the room who had a question. That was Ben Bradley.
What is the status of your optimism, hope, belief that the federal government will ride into the rescue either in the form of the long-promised testing kits, PPE equipment, and other assistance?
I'm going to try to be measured in my answer to your question because, as you know, I've been deeply concerned, I would say frustrated and sometimes even angry at the failures of the federal government. Let me say that there are people at levels below the political levels of government who are working very hard to do the right thing, people who have the experience that's necessary to help us solve the challenges we have in the states. And I talk to them frequently. Sometimes I express to them my frustration. I simultaneously tell them, that I know that this is not their fault specifically. But I have to say that my optimism has waned, honestly. Because I said the other day that the federal government is like Lucy with the football, and I feel like Charlie Brown. And so this has happened a number of times now. Weeks ago, you can look back at press conferences or comments that I made weeks ago. Weeks ago, we were promised tests. We were told right around the corner. I was told by people at the highest levels, right around the corner, we're going to see more and more tests. And then weeks went by. Now, are we seeing more tests? Yes, but not even at the numbers that were promised weeks ago. And now they want to say, they want to try to play games about the numbers. All I can tell you is that the great people of the state of Illinois, the people who work in our hospitals, the researchers, the laboratory technicians, they're the ones, the doctors here, they're the ones who've actually figured out how to test and have spun up testing all across the state. We, of course, our laboratories, the state IDPH laboratories were the real, front lines. They're the ones who they put on a second shift. They've been doing more and more tests. I mean, they've had to put aside some other testing that they do in order to make sure that we're getting the COVID-19 testing done. So I'm frustrated. I mean, I'm hopeful in a way that that the commercial laboratories and that the private sector will help us figure this out, because so far the federal government hasn't. Just one example, private companies have developed or are developing rapid COVID-19 tests, things that don't take 4 or 5 hours to get an answer for, but something that you could do on the spot. That would be, a revolution here. And so I'm hopeful in that regard that we're going to get help, because, the ingenuity of the people of Illinois, the ingenuity of the private sector, the ingenuity of the people who are working in the laboratories at the hospitals all across our state is heartening.
All right. Thank you, everyone.
Yep, thank you.